purpose of my presentation was to discuss the role of the dietitian in a setting using telehealth to deliver care. As a food allergy specialist dietitian, my presentation focused primarily on the management of food allergy, but obviously when we talk about telehealth and chronic disease management, it's applicable especially to asthma, other diseases, diabetes, stroke, diabetic retinopathy, so any chronic condition. Telehealth can be quite important for patient management. As it specifically relates to food allergy, which is what I was specifically presenting on, it's important to have a dietitian that really understands food allergy and is able to provide patient education at the level that the patient and the family can understand, and then really be able to provide survival skills and teach survival skills to the families. There aren't that many food allergy specialist dietitians in the United States, and for a physician to just send a family to just any dietitian, and I've seen this happen multiple times, sometimes families get confusing advice, conflicting advice, or even dangerous advice. So because there's not a lot of us, the dietitian, as I see it, my role is being able to work with an allergist, a gastroenterologist, maybe even a primary care provider, and work as part of the multidisciplinary care team that can help make sure that those families have those survival skills, and especially in children, making sure that those diets are nutritionally adequate so that the child can grow like they're supposed to. So every state's going to be a little bit different in terms of the level of implementation and how successful it's been. Part of that is because of insurance coverage, state legislation, and how doctors are able to deliver care and offer care. I think in South Carolina, where I'm from, it's been pretty successful in certain pockets of the state because there have been a few of the large hospital systems that have adopted a telehealth model and are doing different pilot programs to reach rural communities. But I think in South Carolina, just as an example, there's still a long way to go to be able to reach people that live in rural communities, or maybe just live in small cities that don't attract the specialists, and they still end up with a 2 or 3 hour drive to be able to get to an appointment. But in South Carolina, we're making grounds, and it's gaining momentum.